Hello everyone, my name is Mohammed Fathul Bari. Today I'm gonna share with you about Clostridium botulinum food poisoning. Happy watching everyone.
Our topic today includes the introduction of the toxin, history, types of the toxin, the characteristics, the causes, types of food involved, the signs and symptoms, lastly the diagnosis and treatment.
Do you know what is botulism? An uncommon, but potentially very serious illness. A type of food poisoning that produces paralysis of muscles via a nerve toxin called botulinum or Botox. It is produced by the bacteria known as Clostridium botulinum. Let's get to know about the history of the outbreak. First discovered in 1793 as foodborne botulism by Justinus Kerner, a German physician, associated with spoiled sausage and aptly named botulism after the Latin word for sausage, botulus. In 1897, Emil von Ermayen was able to correlate Clostridium botulinum to the disease. January 1998, Buenos Aires, Argentina. 9 of 21 bus drivers developed foodborne botulism. Symptoms included acute cranial including ptosis, dysphagia, blurred vision, motor weakness, respiratory failure. Attributed to metaber, which was boiled at 78 to 80 degrees Celsius for 4 hours, sealed in a plastic wrap, and inadequately refrigerated. Not adequately cooked, stored in anaerobic environment, and refrigerated only at 10 degrees Celsius. No fatalities. 1 case of foodborne botulism from beef stew in Arkansas, June 1994. Progressive dizziness, blurred vision, slurred speech, difficulty swallowing, and nausea. Patient was hospitalized for 49 days, including 42 days on mechanical ventilation. Next, the outbreak. 19 cases of wound botulism in California. 1,995.18 cases are associated with intravenous drug users. 2 cases reported the requirement of mechanical ventilation for 47 days. Botulinal antitoxin and penicillin were administered. Moving on to reported U.S. botulism cases in 2001. Total of 169 cases of botulism intoxication, 33 cases of foodborne botulism, 112 cases of infant botulism, 23 cases of wound botulism, 1 case of adult intestinal colonization, 3 fatalities. Wound botulism. 20 to over 23 cases reported resulted from intravenous drug users, mostly occurring in California. 1 case resulted from a motor vehicle accident. There are various types of botulism such as: the first one is foodborne botulism, from eating food that contains the botulinum toxin. Second is wound botulism. It is caused by the toxin produced in a wound infected with the bacteria Clostridium botulinum. Third is infant intestinal botulism. When an infant consumes the spores of the bacteria, the bacteria then will grow in the baby's intestines and release the toxin. Lastly, adult intestinal botulism, as the infection becomes severe due to Clostridium botulinum, typically following abdominal surgical procedures. What is the characteristics of Clostridium botulinum? Clostridium botulinum is a gram-positive spore bacteria that obligates anaerobic bacillus. It's also ubiquitous, resistant to heat, light, drying, and radiation. The specific condition for germination is such as anaerobic condition with mild alkalinity at 10 to 50 degrees Celsius. Do you know what are the causes of botulism? The Clostridium botulinum itself is found in soil and untreated water throughout the world. It develops spores that can survive in improperly preserved or canned food that is low acid, where they produce a toxin. As the food eaten, even a tiny amount of this toxin can lead to severe poisoning. The food that can be contaminated includes home-canned vegetables, cured pork, ham, smoked or raw fish, honey, corn syrup, baked potatoes cooked in foil, carrot juice, and lastly chopped garlic in oil. Do you know what are the signs and symptoms after being affected by the toxin? The early symptoms include double or blurred vision, drooping eyelids, difficulty in swallowing, slurred speech, and shortness of breath. Others than that, vomiting, belly pain, and diarrhea can also be the sign of symptoms. Later, you may experience difficulty in urinating and also have a severe constipation. No matter how you are being infected by the toxin, the symptoms are usually the same. The most defining symptom is weakness that starts on both sides of your face, goes down to your neck, and then to the rest of your body. For infants, the symptoms could be lethargy, poor muscles tone starting in the head and neck and moving down, poor feeding, drooling, and weak crying. How about the diagnosis procedures after being exposed to the toxin? To diagnose botulism, the doctor will check the sign of your muscle weakness or paralysis, such as drooping eyelids and a weak voice. Doctor may also concern about the food you've eaten in the past few days and ask if you may have been exposed to the bacteria through a wound. As for the infant, the doctor may ask if the child has eaten honey recently and has had constipation of sluggishness. Analysis of blood, stool, or vomit for evidence of the toxin may help confirm an infant or foodborne botulism diagnosis. Don't you ever wonder about the treatment? For cases of foodborne botulism, the doctors sometimes clear out the pathway of the digestive system by inducing vomiting and giving a medication to induce bowel movements. If the patients have a botulism in a wound, doctor will need to remove infected tissue surgically. The other way is by injecting antitoxin. If the patient's diagnosed early with foodborne or wound botulism, the injection should possibly reduce the risk of complications. The antitoxin works by attaching itself to the toxin in the bloodstream and keep it from harming your nerves. Antibiotics are also recommended for the treatment of wound botulism. However, these medications are not advised for other types of botulism because they can hasten the release of the toxins.
During World War II, there were attempts to weaponize the botulinum toxin to use against the enemy. Though these experiments never led to a useful weapon, other uses were discovered, such as for medical and cosmetic benefits. Botox is a derivative of the toxin. Patients suffering from pain due to migraines, constricted nerves, and muscles have found relief from Botox injections. And the use of Botox for cosmetic use has developed into a billion-dollar-a-year industry. Botox injections work by paralyzing the facial muscle that is injected, thereby making the skin look smoother.
Thank you for watching.